Hi, this is Dr. Girish AC, consultant plastic and cosmetic surgeon. I am heading Curls and Curves Cosmetic Surgery Center, Vijayanagara, Bangalore. The hair transplantation is a cosmetic procedure which treats in the late stages of the hair loss. In the early stage of hair loss, that is in the early thinning or a mild thinning, at that stage, usually the medicines are prescribed. Minoxidil or multivitamins are prescribed. So, in the next stage of the thinning, we usually advise PRP, that is platelet rich plasma, or the GFC, that is growth factor concentrate. So, with this combination, the hair loss can be postponed or controlled. The root cause for the hair loss is hereditary or genetic. Contrary to the common belief, the hair loss can happen because of the stress or the pollution, hard water, and so many things. These things are not correct. It is as per the genetic destiny, so the hair loss will happen. In the later stage of hair loss, that is severe thinning or baldness, so which can happen in case of both male and females, the hair transplant will help at this stage, not in the early stage of hair loss. Donor area is usually at the back. So we remove the hair along with the root through FUE technique. So this is transferred to the recipient area wherever it is required. So the recipient areas can be the scalp in case of both male and females. So in case of male, even mustache, beard can be improved with the hair transplantation, and in case of females, eyebrow transplants are also done. So overall, this hair transplant, the results are permanent. It is for lifetime, and depending upon the requirement, we calculate how many grafts to be transferred, and accordingly so many grafts are harvested from the donor area at the back, and the results are achieved. So this is a daycare surgery done under local anesthesia. There are two methods in hair transplantation. One is FUT and another one is FUE. FUT is a follicular unit transfer, and the another one is FUE, that is follicular unit extraction. In FUT, the strip is excised from the back and it is livered, the individual graft separated, then transferred. So there will be one line scar at the back. Whereas in FUE, individual grafts are harvested from the back using very fine punches. So we usually use around 0.8 or 0.9 mm punches. On the day of surgery, usually when they come in the morning after having some breakfast, we usually take a photographs as it is. Then we mark the area. We discuss like how many grafts to be transferred. Then we do a zero trimming. Once again, photos are taken, marking is redone, it is shown, confirmed, and under local anesthesia at the back, we harvest the graft, so which takes around 3 hours. After that, once again, one food break is given. So after that, we give once again local anesthesia to the forehead, and we make slits in the recipient area when grafts are transferred. The overall procedure roughly takes around 6 to 8 hours. The whole procedure is pain-free except when we are giving local anesthesia. That is usually around 5 to 10 minutes time. Even that is minimized using the very fine needle and the vibrators. So these things will also reduce that minimal pain. After the procedure, the dressing is done, headband is given. They need to stay at home for next 1 week because of the dressing at the back. Only care is just a minimal care. They need to apply some ointment to the grafted area. We prescribe the antibiotics and painkillers to control and to avoid the infection. So more or less the whole procedure is pain-free except when we are giving local anesthesia. So after the discharge, so they will be at home for next 1 week because of dressing. Otherwise, they will be very much normal. If they have a scope to do from work from home, definitely they can resume from next day. They can have normal body bath from next day. They are advised to take the head bath after 1 week. So from there, we advise to use some medicated shampoo for next 3 to 6 months to avoid any untoward infections, which usually does not happen with our protocol and techniques. They are advised to have some medications for initial 1 week. So after 15 days, they are advised to use some minoxidil hair oil and some multivitamin biotin tablets to be taken. So naturally, the transplanted hair will fall off within 1 to 2 months time. All of them will fall. So then they start regrowing from 3 to 4 months end and continue to grow. So maybe by the end of around 1 year, so they can appreciate the final results in case of males. In case of females, more or less 1.5 to 2 years to appreciate the final results. So it is a permanent solution. Hair will keep growing one can have haircut, oil, shampoo, everything apply. So they can treat it as a very natural hair. There is no difference as such, and it stays for lifetime.